So we briefly gave an introduction about menopause in my previous video. So now we'll talk about what your doctor will advise when you go to them. First and foremost, they will of course talk about the lifestyle changes. Apart from the diet and exercise we discussed, they will also strongly recommend reduction of smoking, taking alcohol as well as caffeinated drinks. These all can aggravate your symptoms. Secondly, they may suggest you medications such as hormone replacement therapy. So what's hormone replacement therapy? It's basically replacing the hormones which your body naturally produces, which is estrogen and progesterone. If you have had your hysterectomy done, that's the removal of the uterus, then they may suggest just estrogen only hormone replacement therapy. Although there is a lot of fear amongst the general public about hormone replacement therapy, it's not all that bad. It's in fact beneficial when we assess the risk factors appropriately and give the right medication to the right person. First and foremost, the symptoms of hot flashes, night sweats and the vaginal dryness which cause painful sex are because of the low estrogen levels. So a HRT is very helpful in reducing these symptoms. If you have hot flashes and night sweats, then taking a tablet form is necessary. Whereas if your symptoms are only of vaginal dryness, then your doctor may consider giving you a cream, estrogen cream to apply locally, and the impact of the cream on general body is very minimal and can be very helpful for those who are skeptical about taking the tablets, as well as for those who have other risk factors which prevent them from taking the tablets. Secondly, the other type of medications which your doctor may suggest include complementary medicines. The complementary medicines, however, have not had much trial gone into them and we do not know the side effects very well. These are all herbal medicines. However, herbal medicines are not always, doesn't translate to being good. Of course, they are not so risky, you can take them, but they have to be taken appropriately within limited dosages. That includes evening primrose oil, black cohosh, St. John's wort, etc. These are the medications which we usually recommend when you come to us. Coming to hormone replacement therapy and its effect on unseen organs, it is very beneficial in improving your cardiac health. You may be surprised to know that women are at lower risk of heart attacks before they achieve menopause than of the men. However, once we reach that menopause, our risk of heart attack is almost equal to that of men, and that's because of low estrogen levels. So HRT definitely improves our heart health. Secondly, the effect on the bones. Ovaries are not just serving the purpose of giving us babies. They also produce the estrogen hormone, which helps in a lot of things, including keeping the vagina moist, heart healthy and bones healthy as well. So how do they help with the bones? They actually help in deposition of calcium in the bones and making them stronger. When the estrogen levels go down, then the calcium deposition into the bones can lower, and that can lead to what we call osteoporosis medically, or thinning of the bones. That's the reason why women in their 60s and 70s are at increased risk of fractures, especially of the head of the thigh bone as well as the vertebral fractures. So HRT is very helpful. Your doctor will also recommend calcium tablets in order to improve your bone health. So menopause is a new phase in life. It comes with a lot of symptoms. However, we can deal with them very effectively and lead our life, especially our retirement life most of the times, with a very good quality and enjoyment, as long as we know what to do. So if you have any questions, please don't hesitate to contact me. Thank you.